Hi everyone, my name is Evelyn Perales from BSN a second year nursing student of Northern Niger State College of Science and Technology. For today's video, I am going to demonstrate hot seats bath. Hot seats bath. It is the local application of moist heat in which the buttocks, lower trunk, or pelvic area is immersed in warm water. It can help relieve pain and discomfort to the perineal area, such as after childbirth or surgery. It can also increase circulation to the tissues, promoting healing. A sitz bath may be created simply by filling a bathtub with some water and sitting in a few minutes. Alternatively, a large basin can be used. There are also special devices that can be used to toilet bowl. Sitz bath may be either a warm or cool. It may be filled with just water or substances such as salt, baking soda, or vinegar can be added. The purpose for this is to aid healing a wound in the area by cleaning and discharges and slough. Also to induce voiding in urinary retention, to relieve pain, congestion, and inflammation in cases of hemorrhoids, tenesmus, rectal surgery, anal fissures, after proctoscopic or cycloscopic exams, sciatica, uterine, and renal colic, and also to induce menstruation. As per the assessment, first, review any orders related to sitz bath. Second, determine the patient's ability to ambulate to the bathroom and maintain sitting position for 15 to 20 minutes. Then inspect the perineal or rectal area for swelling, drainage, redness, warmth, and tenderness. And of course, we assess bladder fullness and encourage the patient to void before sitz bath. As for the objectives, this is to relieve congestion in the pelvis, to relieve tenesmus or ineffectual and painful straining at stool and in urinating. Also to relieve painful hemorrhoids, to relieve pain after cystoscopy, vaginal hysterectomy, vulvectomies or extension of the vulva, episiotomy during childbirth, and hemorrhoidectomy. Before we do the procedure, we need to prepare all the necessary equipment such as the sitz bath basin. As showing, this is our sitz bath basin. We have water bag here. The salt, of course, we can also use vinegar or baking soda. And our clean gloves, this is required. A pitcher with hot water, bath towels, and of course our cold compress or ice cup. For general consideration, the initial temperature for sitz bath is 98 degrees Fahrenheit to 110 degrees Fahrenheit or 36.6 degrees Celsius to 43 degrees Celsius, or as hot as the patient can tolerate. Also, we prevent overexposure of the client by draping bath blankets over the patient's shoulder and thighs, controlling drops. Also, the client should be in a basin or tub with feet flat on the floor and without pressure on the sternum or thigh, because exposure of the large portion of the body heat can cause extensive vasodilation. And also, it may be necessary to add warm water during the procedure, which is usually lasts at 20 minutes to maintain the constant temperature. For the procedure, always remember to check physician's order for sitz bath. This is to prevent error when carrying out doctor's order. Then we identify the patient. Positive identification of the patient is essential. This is to ensure that the intervention is administered to the correct patient. Good day, ma'am. My name is Ethel Jane Perales, your student nurse for today. So, can I check your wristband, ma'am?
Okay.
Can you state your full name, ma'am?
Mika Diaz.
How about your birthday, ma'am?
Jan 1, 1996.
Okay. So after identifying the right patient, we need to explain the procedure to the patient to relieve anxiety and to facilitate cooperation. So today, ma'am, I'm going to perform a hot sitz bath. It is a local application of moist heat, which is the buttocks, lower trunk, or pelvic area is immersed in warm water. It can help relieve pain or any inflammation and discomforts in your perineal area. And also, this increased circulation to the tissues, promoting healing. This is to induce voiding in the urinary retention and also to induce menstruation. This procedure wherein I'm going to remove your underclothing is to expose the necessary area that is being treated. So would that be okay for you, ma'am?
Okay.
Alright, thank you for that, ma'am. So after explaining the procedure to the patient, we need to close curtains around the bed and close the door of the room if possible. This is to ensure the patient's privacy. So ma'am, I'm going to close the door now. So after providing the patient's privacy, we need to perform hand hygiene and put on gloves. Hand hygiene deters the spread of microorganisms. Gloves prevents exposure to blood and body fluids. So we're done in performing hand washing. Now we're put on the gloves. After putting gloves, we assemble equipments in the bathroom. Organization facilitates good performance of tasks. So, assuming that this is our toilet, we raise the lid of the toilet here, and then we place the bowl of sitz bath with drainage port, exterior, and infusion port in front in the toilet. So here is our bowl of sitz bath. Place it. So we fill bowl of sitz bath about halfway full with tepid to warm water. Sitz bath will not drain appropriately if placed in the toilet backwards. Tepid water can promote relaxation and help with edema. Warm water can help with circulation. We can also add salt. Let the salt dissolve on water. After assembling the equipment, we ask permission to the patient to remove clothing that covers the area. This is to expose the area and assess the area that is being treated. Ma'am, may I able to remove your underclothing or your underwear?
Yes, that's fine.
Okay, ma'am. So So, ma'am, I'm going to expose now your perineal area. Then we inspect cranial or rectal area for swelling, drainage, redness, warmth, and tenderness. Also, we assess bladder, fullness, and encourage patient to void before SITZ bath. Ma'am, may I ask if have you voided recently?
Yeah, I did.
Okay. So since our patient's already voided, then we can now proceed to the next procedure. After assessing the perineal or pelvic area, we clamp tubing on the bag and fill bag with some temperature water as mentioned above. So this is our hot water bag. Then we clamp the tubing on the bag here. Then we fill bag with some temperature water as mentioned above. So I already filled the bag with temperature water. Really, it's either be warm or cool, depends on the doctor's order. Then we hang the bag above the patient's shoulder height or on the IV pole. If bag is half lowered, the rate of flow will not be sufficient and water may cool too quickly. Then we insert tubing into the infusion port of SITZ bath. Then we assess patient to sit on the toilet and provide any extra draping if needed. Provide extra draping necessary. So, assessing the patient prevents stripping the tube, which is attached to the front of the bowel. Then we slowly unclamp tubing and allow SITZ bath to fill. Make sure to slowly unclamp the tubing. We clamp tubing when SITZ bath is full. Instruct patient to open clamp when water in the bowel becomes cool. Then we ensure that call bell is within reach. So, assuming this is our call bell, right beside of the client, instruct patient to call if she feels lightheaded or dizzy or has any problems. And also, we instruct patient not to try standing without assistance. Ma'am, if you feel like something lightheaded or dizzy, you can tap the call bell to call us. Also, please do not try to stand without any assistance. Okay?
Okay.
Cold water may produce hypothermia. On the other hand, patient may become lightheaded due to vasodilation, so cold bell should be within the reach. Then we place the cold compress or ice cup at the back of the neck or on the head of the patient. So this is to help alleviate feeling of weakness. Less amount of blood in the head will cause the pain, and ice cup is applied to cause the blood vessels to constrict so that the blood will remain on the head. When patient is finished in about 15 to 20 minutes, help patient stand and pat perineal area dry. Patient may be lightheaded or dizzy due to vasodilation, so patient should not stand alone and bending over to dry cell cause patient to fall. Then, we assess the patient to bed or chair. Then we ensure that call bell is within reach. So now that our patient is in a comfortable position, we empty and disinfect the SITZ bath bowl according to the agency policy, and we remove gloves and perform hand hygiene. Proper equipment cleaning and hand hygiene deter the spread of microorganisms. Discard it into waste receptacle and perform hand hygiene. Now we are done in performing hand washing, then we proceed for our evaluation. So for our evaluation, increased circulation occurs to the affected area and increased warmth occurs to area of application. So operation progresses, so the pain is decreased with heat application. So after evaluation, we do recording and reporting. So record procedure, the patient's chart, the date and time bath was given, temperature of water, duration of bath, effect and reaction of the patient. So that is all for my video, and if you have questions and comments, just let me know. But if you don't, then see you in the next one.